Coming up, we continue our Indigenous Peoples Day celebration this week. We're highlighting the stories and people from across Turtle Island. Join us for this special edition of the ICT Newscast.
This program is made possible by the Corporation for Public Broadcasting, a private corporation funded by the American people.
The ICT Newscast is sponsored by the Indian Land Tenure Foundation, a nonprofit organization serving American Indian nations and people in the recovery and control of their rightful homelands. On the web at iltf.org.
Support for the ICT Newscast with Aliyah Chavez comes from the Arizona PBS studios in Phoenix at the Walter Cronkite School of Journalism and Mass Communications at Arizona State University.
Amadawa Hopa, thank you for joining us for this special edition of the ICT Newscast. I am Aliyah Chavez. For Indian country, women's health is a priority every day. In May, Santee descendant Sasha Houston Brown joined us to talk about new health guidelines and self-care.
Thanks so much for having me.
Last week, a U.S. task force gave new guidelines for mammograms. What should Native women know about these new guidelines?
Yeah, so the new guidelines really tell us that really beginning at age 40, women should get screened for breast cancer every other year. So for all the aunties and moms and sisters, really encourage each other. Get out. Early detection is key in preventing breast cancer. The old guidelines said 50, and we know that, our communities face those higher rates, so early screening is key for overall health.
For Native women who go to the hospital or the clinic, sometimes it can feel really daunting. I know I feel that way myself. What kinds of advice would you have for Native women to really take control of themselves and their bodies when going to these kinds of appointments?
Knowing your own body is key, right? Like knowing what feels normal for you is so important, and it's going to be different for every single person. So getting a feel for, what your normal sense of normal is helps to understand what, when something's off or it doesn't feel right. And I really like to tell people that if you are in pain, if something doesn't feel right, please speak up. I know it can be so daunting and feel like you're not heard, but it's so important to never ignore pain. And if you feel like you're not being listened to, please ask to see another nurse or a different doctor. It's so important that our voices are heard.
I think the other part of that statement is that, of course, health and wellness takes many forms. It's also mental health. Maybe talk about that.
Health is so holistic, mind, body, spirit. Native women are under such constant levels of toxic stress. It's really important for us to take time, even a few minutes a day, to prioritize your own well-being, right? It's cliche, but it's true. You can't take care of others or show up in life unless you're prioritizing your own health and wellness. So, if you are struggling with mental health, please reach out to some of those resources that exist in your community. We have things like the Strong Hearts Helpline, and also do what feels good for you. Maybe that's going to ceremony. Maybe that's going out for a walk. Find those moments each day to replenish yourself.
Last week on the show, we had a dentist on the show to talk about oral care. And we actually found that sometimes pregnant women with a lack of oral health can actually translate to their babies. For women who are pregnant and maybe are looking for more resources to help them along their pregnancy or make sure that they're having healthy children, what advice would you have there?
Yeah, again, I think it's so important to know your own body, to be a good advocate for yourself. I also think it's important for, our relatives to support our new moms to be and really show up for them. Sometimes going to appointments with a loved one is so important to be an advocate. Also prioritizing nutrition, getting out for those walks, prioritizing mental health and overall well-being is so critical. Really that time for our pregnant moms, in many ways, it is that ceremony, and care for them and bringing that new life into the world is of the utmost importance. So really advocate for all those new moms in your life, show up, help them out, and take those small steps to care for yourself when you are with child.
And the flip side, of course, is elders and caring for elders in our community.
Absolutely. I definitely would encourage that, all of our elders and our family members to support our elders in terms of taking charge of their own health. Walking is a really big thing I like to recommend. If you can, getting out, even for a short 5, 6, 8-minute walk is huge. A lot of our tribal fitness centers also have tracks that are really great for indoor walking, treadmill, knowing a lot of our communities are not accessible, right, for walking or running. So finding creative ways and really prioritizing our elders. Maybe we bring our elders a healthy meal once a week. It's so important, and we really need to live those values.
When it comes to nutrition, are there any small steps that Indigenous women can take to better their health?
Absolutely. Nutrition can be so overwhelming. I always like to tell people, think about what you can add into your diet versus take out, right? Instead of removing your favorite foods, let's think about adding in some fresh and healthy foods. So maybe that's adding in a serving of veggies at lunch and dinner. Maybe it's adding in a serving of accessible protein, deer meat, fish, some traditional foods in one meal. Also, as a reminder, frozen fruits and veggies are just as nutritious as fresh, and a lot of times more accessible in our communities. So those little steps really add up. You don't need to deprive yourself. Think about it from an abundant standpoint and those things you can add into your meals.
Well, Sasha Houston Brown on National Women's Health Week, thank you so much.
Thank you.
In 2021, the Water and Tribes Initiative estimated 1 in 10 Indigenous Americans lack access to safe tap water or basic sanitation. But that is changing for one Yupik village in southwest Alaska. ICT's Mark Trahant has more.
Sanitation workers start every day riding a four-wheeler along the muddy roads of this small Yupik village on southwestern Alaska's vast Kuskokwim River, looking for human waste. They check honey bucket bins, large steel containers where residents dump their waste at neighborhood collection points. When the bins are full, it's a mile-long trip to the dump. Many Alaska villages don't have running water and flushing toilets. Instead of using a bathroom, people use a honey bucket, typically a 5-gallon bucket with a toilet seat on top and a plastic bag inside. Instead of showers, they rely on steam baths or sponge baths. The village's nearly 700 people are soon getting plumbing for the first time and finding that their lives are transformed. More than 3,000 homes in Alaska, concentrated in 32 villages, lack running water. The people who live in them are among more than 2 million Americans who don't have basic indoor plumbing, according to the U.S. Department of Health and Human Services. And there is a similar story told in other Indigenous communities. ICT's Jacqueline Estes reports on efforts to expand access to water.
Under the Infrastructure Investment and Jobs Act, $3.5 billion has been allocated to the Indian Health Service for water and sewer projects. That adds to money from the Environmental Protection Agency and the U.S. Department of Agriculture that have also received money for water and sewer projects. So this is enough, finally, for a change to really make a difference in Indian country. And that's important because, for instance, on Navajo Nation, 1/3 of the households lack running water. In Alaska, 32 villages are relying on rainwater and rivers for drinking water. So it's $3.5 billion from the Indian Health Service. That's being allocated at the rate of $700 million per year. Alaska got $440 million for 37 projects. I called the Alaska Native Tribal Health Consortium to ask them, how does this compare to what you usually get? And they said it's easily 10 times what they normally get. And so I asked them if they're celebrating, and they said, no, they're too busy hustling to get projects designed and moving towards completion during the short Alaska summer construction season.
Back in Akiachak, West Side residents have had hookups for nearly 2 decades. But work on the East Side, where most of the townspeople live, was slowed for years until village officials met certain conditions to unlock $28 million in federal and state funding. Water is not just an inconvenience, it's a health issue, with higher rates of respiratory illness and skin infections. Native infants in the Yukon-Kuskokwim Delta are hospitalized at 5 times the national rate for respiratory syncytial virus, or RSV, according to the Yukon-Kuskokwim Health Corporation, which provides services for this region about 400 miles west of Anchorage. And the hospitalization rate for pneumonia is 11 times higher for Alaska Native children from villages without plumbed water. Sewer and water hookups change that.
Seems like the community is having, are blessed with the hot and cold water, and I'm proud of it.
In Phoenix, Mark Trahant.
There's a sport getting elders back into the gymnasium, and no, it's not pickleball. Last spring, one tribal nation held its annual senior chair volleyball tournament, and I was there. Let's take a look. Some of these buses and vans drove elders hundreds of miles for the 2023 Senior Chair Volleyball Tournament hosted by the Salt River Pima-Maricopa Indian Community. Serena Padilla is one of the players here. From age 9 until 32, she played softball, but between a knee surgery and getting older, staying active wasn't as easy. That's until chair volleyball.
So it really helps your whole body. And you get to laugh, you get to joke, you get to be around other relatives that are older. And the thing is, they're handicapped too. A lot of them are handicapped, and that really can help them.
32 teams competed in this year's tournament. That's more than ever before.
They travel from San Diego, Nevada, Tucson area. Usually we do 24. This year we got 32 teams in, and we're looking to make it bigger.
So how is chair volleyball different than regular volleyball? For starters, they play with these, which are lightweight and easy to balance. The court is 20 feet by 14 feet, which is half the size of a standard court. The net is 5 feet tall. The game is made up of 10-minute matches, or the first team to score 15 points. If a player's chair comes off the ground, it is an automatic point for the opposite team. Players must be 55 years or older to play in this tournament. Many of the players said COVID-19 affected them greatly and said chair volleyball is just one way to reconnect.
I like the social of meeting everyone. We have so much fun. We are competitive, so we do like to play. But it's for fun, and it's good to see everybody, all the different tribes that come out.
76-year-old Roberta Johnston is Muskogee Creek. As a young girl, her parents moved her from Oklahoma to Arizona. She says Salt River has become her home.
The community has been so good to me. Have treated me so good, and they just make me feel like part of the family, you know, and that's how I always felt. I teach a senior dance group here, and we're called the Steppers also. Some of the ladies thought, well, why can't we get a team and enter the volleyball? So we did. We had all of our steppers, our dancers, and we started a volleyball team.
What the seniors here want people to know is that chair volleyball might not be what you first think.
It gets intense. You know, I know that when the tournaments or before this started, you know, it was all for fun, and we just had fun doing it. But as the years have passed, and when there are more teams starting to come in, and even like California, it's starting to get a little bit more competitive, more intense. So it's just like, I don't know, you know, you're not really thinking about anything, except for me, it's just like, don't mess up.
So has chair volleyball made a difference for elders wanting to stay social and be active?
Yes, it's keeping them active, healthy, and social.
In Scottsdale, Arizona, Aliyah Chavez, ICT News. In September, I spoke to a medical and public health expert at the Indian Health Service about new COVID-19 vaccine recommendations. I started with asking Dr. Loretta Christensen why it's important for folks to get the updated shots when it becomes available to them.
Well, first of all, thank you for having me. And it's very important to keep updated with the latest vaccines because they're crafted in a way to optimize the ability to fight off COVID depending on the variants that are circulating throughout the country. So we have to keep up with the changes in the vaccine so we have the most updated, most effective vaccine available for our population.
When will the IHS actually physically receive the new vaccines?
Well, it's a very complicated process that we are completely prepared for, that we've set up ahead of time. We have all our methods. We've been giving education on the rollout of the new vaccines when they become available. And we just have to basically plug it in our system and get the supply chain moving. So once all that is ready to go, we are ready to go. And all of our facilities can order those vaccines. Whatever is available, they will have that choice between certainly the Pfizer and the Moderna, which are already approved by the FDA, and then pending approval would be also the Novavax vaccine. And that would be sent to them, and they can begin administering it as soon as they receive it.
And will the vaccines be free of charge for people who get them at IHS?
Yes, all of our beneficiaries will receive any COVID vaccines, and actually all of our vaccines through our system with no charge ever to the patient.
And can you talk a little bit about the safety of these vaccines? I know that that's something that people are always curious about. So are these vaccines safe?
Yes, a lot of investigation is done on these vaccinations before they're approved. And certainly we have a history in the IHS of a very robust safety tracking of all the vaccines. And we track this all the time. We have great results. We're able to notice if there's any trends, any untoward incidences, and we track them very, very carefully. So we are very prepared to give out this vaccine, and we feel it will help protect our population. So, there's always things that you can have a reaction to, but we do present that education to our public and our patients to make sure they understand those reactions like soreness of the arm, a little bit of redness, maybe some little bit of fever and muscle ache. And that's routine with pretty much every vaccine.
We've heard so often about new COVID-19 variants, and right now there, of course, are a few that some are concerned about. But I want to ask you, in your expert opinion, how concerned you are about the new variant?
Well, the American Indian Alaska Native population is always more vulnerable due to the health status that we deal with on a daily basis. So as we suspected that COVID would hit us very hard, we are very vigilant when there's new variants. I anticipate this will continue to happen, just like the flu has changed so many times over the years, and we do an annual flu influenza shot because we try to capture what will be most effective for our population. And the same thing I think will become of the COVID vaccines. It will adapt to what is circulating and is of concern to us across the United States and certainly across the American Indian Alaska Native population. So we will continue to see this. We know because of that vulnerability, we still say really good hand hygiene. If you're coughing, you're in a closed space, you might want to choose to wear a mask. And we just tell everybody to be very vigilant because our more vulnerable can, of course, get quite ill from getting COVID.
Dr. Christensen, I'm so happy that you brought up the flu. For folks who want to get the new vaccine and the flu vaccine, is that something that they can do?
Absolutely, they can get that in a visit to any one of the facilities. We do recommend, I want to add, we call it the tridemic. We're looking at this season of COVID, influenza, and RSV. So anyone over 60 and pregnant persons, and of course our infants, should be treated for RSV because all three of those can have very similar symptoms. And the better we can prevent any vaccine preventable disease, it's a benefit to the population. So if they get all those vaccinations, that drastically decreases them having get one of those three things: the flu, RSV, or COVID.
We saw early in the pandemic that COVID-19 was disproportionately affecting American Indian and Alaska Native communities. Are you still seeing that same data, or what are you seeing right now?
We are still seeing that data. I will say, thankfully, it's better. At the beginning of COVID, we were over 4 times more likely to have a death from COVID. We were 3+ times more likely to be in the hospital, and we were over 2 times more likely to get COVID. Those numbers have settled quite a bit, and I think a lot of that is because we had such a positive vaccine experience. We got it out into the community, the people stepped up. And because of that, we saw the mortality go down, we saw the hospitalizations go down, and we saw the cases go down, but they still are higher than most of the general population.
If I am someone who has already gotten COVID-19 and I recovered, should I still get the new vaccine?
Yes, because you can get COVID again. You know, anytime that you are exposed to COVID, you're at risk for having a new case of COVID. After a case of COVID, you do have some time period up to 90 days where you're fairly well protected by your own immunity, but you can get COVID. So you may have it once or multiple times. And then for those few that are very, very lucky that never had it, then that's good for them.
My next 2 questions will be just a little bit of a refresher. Can you tell us what the current symptoms are for COVID-19? And if you test positive, what you should do?
Okay, well, you know, the symptoms, they do vary a little bit with the variants, but it's typically a sore throat, fatigue, muscle weakness, and fatigue, stuffy nose, slight fevers, and definitely people feel very tired at that time. I'm sorry, as far as what you do want to isolate. You know, if we have all the at-home testing. Once you test positive, you want to stay home for at least 5 days, hopefully 10. If you must absolutely go out, you have to go out with a mask. And if you're in a family or a close situation, all of those people should test on the 5th day after being exposed to you if you're positive for COVID. And we do recommend masking in that case, so that if they go out and must go out, that they will wear a mask around other people so we're not creating more exposure. So we still recommend the isolation.
Well, Dr. Loretta Christensen, thank you so much for your time today.
Thank you. Thank you so much for having me.
Indigenous youth in Standing Rock's Fort Yates district are having fun in new, healthy ways. ICT senior producer Vincent Moniz has all the sights and sounds from the July opening event in North Dakota.
For many kids living in the rural Standing Rock community of Fort Yates, making their own fun is part of the adventure. One of the cheapest and most healthy ways is basketball and skateboarding, but where to do both is in short supply. So, North Dakota-based nonprofit AUN and Montana Pool Service, an organization founded by Pearl Jam bassist Jeff Ament, decided to fix that. Standing Rock citizen and the not-for-profit's co-founder, Billy Joe B. Healer, spoke about the larger Indigenous ideas that went into the park.
Our collaboration is based on our Indigenous worldview, our Lakota worldview of Mitakuye Yuasi. We are all connected. So we find connections with other organizations that want to share a key message to the world. We are still here, we are thriving, and we want to work with other organizations that have this belief as well.
To bring the project to life, support came from Standing Rock itself, and incredibly, even Nike came with gifts. The community celebrated the opening of their world-class skate park and basketball court with a feed and music. This event also included an opening ceremony, the drum group Lakota Thunder, and a skate clinic. Youth skaters traveled all the way from Blackfeet and Pine Ridge tribal lands to join in and help beginners. Plus, members of the Nike Native American Network were there, including N7's founder Sam McCracken and Ambassador Shauna Long. Danette artist and skater Dior Greenwood says skating at the event showed her that anything is possible when a community comes together.
What made me say yes to an event like this is the opportunity to see other leaders creating their dreams and bringing it into reality. Me seeing it firsthand allows me to be the leader I would need to be for my community, and them showing me what's possible only allows me to dream larger and bigger.
The healer, an active community member, said a key moment in her nation's history made it clear why Standing Rock youth should be centered and honored.
In 2016, during the No DAPL protests, our Standing Rock youth took the lead, and for them to go out and put themselves on the front lines for all of us, not just Standing Rock, but for all Indigenous nations, for all local communities, rural communities, for everyone.
From the Standing Rock Nation's Agichdahanska district in North Dakota, Vincent Monaz, ICT News.
And that's a slice of our Indigenous world. For all the latest, visit ictnews.org. From all of us in the newsroom, stay safe, my relatives.
This program is made possible by the Corporation for Public Broadcasting, a private corporation funded by the American people.